Yep. All right, welcome to OrthoStatic, a product, a service provided by the Academy of Orthopedic Physical Therapy. I'll be your host today. My name is Jimmy McKay, and with me, Paul-Neil. How do you introduce yourself? You say at orientation, people are always wanting more, like George Costanza.
Because I usually I'm happy to say Paul-Neil Czujko, I'm a physical therapist, and I kind of just leave it at that. And then, they always want to know all these other things and everything like that. And I'm kind of like, you can go to the website, go to our faculty page, you can kind of read all about that stuff, if you're interested in it. So not a big self-promoter.
Well, we got to promote a little bit. We got to give context.
Sure.
So you said faculty. Where are you on faculty, and what do you get to do there?
I am on faculty at Stony Brook University. I graduated from PT school in 1995 from Stony Brook. I started teaching in 2004. I joined the faculty in 2010, and I actually did clin ed for a couple of years. And now I basically teach in the orthopedic track. So that's kind of why I think I'm here today.
Yes.
Kinesiology, orthopedics, that's kind of my area of interest. Whenever someone asks, what's your area of expertise, the only thing I'm comfortable with saying I'm an expert in is The Simpsons. So when it comes to PT, my area of specialty, my area of interest is orthopedics and sports medicine. So
all right, we'll do The Simpsons. We'll do The Simpsons on another episode today.
Awesome.
Where we'll talk about orthopedics and specifically something that popped up and I didn't really know a lot about when I was going through PT school until probably maybe my second or third year. People started sort of whispering and murmuring about this thing. And it was this thing called specialty exams. And specifically one had popped up in conversation, which was the Orthopaedic Clinical Specialist exam. Other people might call it the OCS exam. So, Paul-Neil, how do you describe it when students or clinicians start talking about it? What is the exam, and maybe who should consider taking it?
Okay. So I was like you. I had really never heard about specialization when I was in school. I started to kind of hear about it, and then I graduated and heard about it a little more, and then I kind of looked into it, and then I kind of went after it. So in terms of the specialties, kind of a more broader overview, the American Board of Physical Therapy Specialties kind of runs all these specialties, and there are 10 of them, and you can go to the website and kind of see any of the other ones. But for the purposes of our discussion, obviously, we're talking about the orthopedic one. So what it is it's a way to kind of recognize that you have a deeper knowledge in a specific area of physical therapy, in this instance, orthopedics. So basically, if you're interested in it, you're interested in pursuing, again, this specialization that just demonstrates that you have deeper knowledge and that you have a deeper skill set and that you focus in this one area of physical therapy.
Perfect. So if someone's nodding along, if they're saying, going through school or going through clinical practice, orthopedics is really what gets me excited. And this might be a path I want to take. Before I leap, I do want to look, right?
Sure.
How do I determine if I'm ready to sit for the OCS exam? What are the prerequisites, officially or unofficially, that I might need to consider before deciding to take the OCS exam?
So first thing you need 2,000 hours of direct patient care hours in the specialty area. So the way this is done, if you go to the website, they give you kind of a nice Excel sheet that says basically a year is 50 weeks. And if you're working full time, that's 40 hours a week. So if you do the math, you're going to work 2,000 hours in a year if you take 2 weeks vacation. And then you break it up on after that. So you'll say, all right, this year I worked 2,000 hours. I spent 75% of those hours in direct patient care because we all have paperwork and other things, administrative issues that we have to deal with. So then you'll say, all right, for that year, whatever 75% of 2,000 is, that's how many hours I spent in direct patient care. And then you'll say, all right, out of those hours in direct patient care, 100% of those were in orthopedics. So that's how many hours that you would claim for that year. So you just kind of go through that little spreadsheet. And once you get to 2,000, that's the first requirement that you need to sit for the exam. And then you need to provide evidence that you have not expertise, but that you have experience in different areas of orthopedic PT. And this is something that's new, Jimmy. As of 2026, as for the new exam, we changed some of our requirements, and these can be seen on the website. But basically what we did was we just went into body regions. So we said, if you look at we broke them up like spine, lower extremity, upper extremity. And again, there's a nice chart on the website. So I'd encourage everyone to look at that. But basically what we did was we said, if you look at the spine, We talk about obviously like TMJ. We talk about cervical, thoracic, lumbar, SI. You need 750 hours in that area. And same thing, if you look at upper quarter, you need 500 hours, lower quarter, you need 500 hours. And the way it's broken up is, I just told you about those 5 areas in the spine. You need to have a minimum of 100 hours in 3 of those 5 areas. So I know this is kind of getting in the weeds a little bit, but again, on the website, there's a nice chart that breaks this up. And basically, if you're someone that's working in a general orthopedic clinic and you're just treating general orthopedic patients with back pain and neck pain and shoulder pain and knee pain and ankle pain, you're going to knock off all these hours fairly easily. It's basically for someone who may be a little more specialized in clinics where maybe they don't get to see a lot of spine or extremities or something like that. And there are ways that you can attain those hours. So you can observe a certified hand therapist. And if you observe them for 100 hours treating in the clinic, they sign off, and then you've had hours in that subset. So that's basically kind of the second piece. So it's the 2,000 hours, and then it's kind of how those 2,000 hours are broken up, and that's basically it. That's basically the 2 qualification or the requirements that I should say you need. And in terms of if someone is thinking like, why should I do this, or am I ready for it? Kind of 2 different questions. I think why you should do it, that's inherent up to you. You know, if you feel like you've been working in this area, you've been working in orthopedics, it's your true love, and you feel like that, you know, you're going to courses and you're reading articles and you know more than just your average bear. This is a way to identify that. And this is a way to show the public that, you know, I'm above average, that I've attained this, I possess this knowledge, and I've proven that I have this knowledge in this specialty area.
Yeah. Any suggestion for what someone, you know, who's considering this, talking to someone who's gone through the OCS might pop up? You know,
yeah, I think that's a very good idea. There are resources that you can use to study for it. Obviously, if you're interested in it, the section puts out the current concepts, which is an awesome. I think even if you're not thinking about it, it's absolutely awesome for clinic practices as well. So that's an excellent resource for gaining knowledge. In terms of when we look at these specialty exams, when you look at the licensing exam, when we write questions for the licensing exam, those are referenced from textbooks, because we want to make sure students have entry-level knowledge.
Sure.
This is beyond that. So I would encourage people, if you're reviewing for this exam, you want to get into the literature. You want to be looking at journal articles to make sure that you're up to date on current practice. And we use articles that people should have access to. JOSPT, American Journal of Sports Medicine, British Journal of Sports Medicine, kind of the real kind of common ones that are very referenced in our literature. So again, I think if you're thinking about it, it's more inherent. If you're kind of thinking, and if you're in the clinic and you're thinking, you know, I feel like I'm good at what I do. I feel like I strive to learn more. And, you know, I kind of want to be identified for that. Then the OCS is for you.
Yeah. And that's typically what the profession of physical therapy, from where I've seen, that's the type of person it typically draws. So if you're in orthopedics, 100%. It feels like the next step.
Yeah.
So you mentioned body regions in terms of acquiring the hours to be able to sit for the exam. Yeah. Let's go beyond that. Now you're sitting and you're preparing for the exam. What are the key topic areas and areas of focus that you should be paying attention to as you go through that study process?
Okay. So, the exam breaks it down a couple of different ways. So when it comes to kind of just knowledge areas, we talk about anatomy, movement science, pathology, or that pathophysiology piece, pain science, and that's kind of a newer one that we just added and are adding items to the exam. Medical and surgical considerations, and obviously orthopedic physical therapy practice, and critical inquiry, so evidence-based practice. So that's kind of the research piece. So those are kind of the areas that you want to think about. And then when it comes to the tasks that are involved in those areas, it's kind of, I think, what people would expect: examination, evaluation, diagnosis, prognosis, interventions, and outcomes. So you're kind of using those tasks over those knowledge areas, and then you're applying those to the body regions.
Sure. Okay, good. Now let's get really specific.
Sure.
For anybody who is preparing for this, they want to make sure whatever time they're investing for all the blood, sweat, and tears, hopefully not as many tears as blood, But all the effort you're putting into it is going in the good direction. In terms of study materials, I know when I was preparing for the NPTE, I didn't decide which resource was better. I bought a couple of those.
Yeah.
But you mentioned one. So in terms of study materials and resources that are most effective for preparing for the OCS exam, what are a couple you might suggest?
So again, I think Current Concepts is an excellent product. If people that might be unfamiliar with it, it's a series of monographs published by the Academy of Orthopedics, and it covers every body region. So shoulder, elbow, wrist, hand, lumbar spine, cervical spine, thoracic spine, ribs, everything in the lower extremity. So it covers everything. So maybe if you don't have great experience in one of those areas, this can really help you. It's published every 5 years, and it's up to date. So if you purchase it and you use that as a resource, you know that you're gonna be up to date on current information in all those areas. So that I think is an excellent resource. The clinical practice guidelines are another one. Those are, in my opinion, very well done. And they reflect current clinical practice. Sure. Again, the folks that put those together review all the literature, and then they make the best evidence-based recommendations about what you should be doing with a certain condition in terms of these are the best outcome measures you should be using. These are the best interventions. These are the best examination techniques. So I think those two resources, all the current concepts, or all the current concepts and the clinical practice guidelines, and the clinical practice guidelines are free. You can go to the JOSPT's website. You don't have to be a member, and you have access to all, I think there's 21 of them now. And if you put those two resources together, that puts you in really, really good shape in addition to your clinical practice. And then, like I said, as things come out in JOSPT and these newer journals, if you're keeping your eye on that, you'll be in pretty good shape for this exam.
Perfect. And yeah, Current Concepts in its 5th edition right now. They're already preparing for the 6th edition. That's available at orthopt.org, as well as those CPGs. All those different CPGs available for free right now, if you're a member or not. All right, so now let's get into even more of the nitty-gritty. We're getting more and more specific. How do I balance exam preparation? Because I'm also, as you mentioned, a lot of people currently working in the clinic. So how do I balance exam prep with my current professional and work responsibilities? What's a suggestion or two?
So it's kind of similar to what I tell students when they're reviewing for the NPTE. Pay attention to the content outline. The content outline is the blueprint for the exam. So when I tell students, look at the NPTE, if there are going to be 3 to 5 research questions on a 200+ question exam, you probably don't need to spend 2 weeks studying that area, because that's not going to be time well spent. If there's going to be close to 50 musculoskeletal questions on that exam, you probably want to spend a decent amount of time on that. I think this is no different. When you look at the body regions, we don't have the same amount of items per body region. So lumbar spine is about 20% of this exam. Shoulder is about 15% of this exam. So I think you want to pay attention to that. And if you have limited time, which we all do, you want to make sure that you're going to spend a decent chunk of that time on the lumbar spine, because that's going to be a good 40 questions or so on this exam. TMJ is about 3%, so you're talking 6 questions. So, maybe you don't spend 3 weeks on that. So I think that helps you balance it out, because you say, all right, I have work, I have family, I have some other things. So this is how much time I have to study for this exam. And then once you get into that, you want to look at the areas that are going to be most represented on the exam and make sure that you kind of dedicate time to that.
Yeah. That's a good suggestion to mimic your study patterns to the actual exam. And a lot of these exams, I was surprised, but when you look into them, they are very transparent in terms of percentages and proportions of different regions and different types of questions on there.
Absolutely.
So use those given resources.
And I can tell you that, those are not suggestions, and it's the same for NPTE and for this exam as well. When we say 20% of lumbar spine, we're not going to have 100 questions on the lumbar spine. We're not going to have 2 questions on the lumbar spine. When PSI, the company that puts the exam together, they stick to this blueprint really, really close. So those numbers are really, really accurate. So I can't emphasize enough that you kind of want to have that handy when you're studying, because it does help you, I think, apportion your time correctly.
Yeah. Prepare for the test that you're taking and understand that is the test that you're actually taking.
Absolutely.
Perfect. All right. So some common challenges. There are some things that come up frequently. What do people run into in terms of pitfalls in the exam preparation or while they're taking it? And then the $1 million question, what are some suggestions to avoid those things?
All right, so some pitfalls. You mentioned it before. I think you need multiple resources to study for this exam, How many is up to you. So if you're someone that can really assimilate and absorb stuff, maybe you're going to get current practice. You're going to get all the CPGs. Maybe you're going to take an online course. There are online courses that are available. I know a couple of colleagues that have taken them and spoke very highly of them. It's not my job to advertise for them or anything like that, but they're very well known. And I've looked at some of that material and I think it does a nice job. So you might be someone that can have like 4 or 5 different resources and you can get through all of them. And that's wonderful. You might be someone that can't quite do that. So maybe, you mentioned 2, maybe you're just going to say, let me get through current concepts. Let me get through the CPGs and maybe let me see where I am after that. It kind of, you have to be very reflective and say, how much time does it take me to get through X amount of material? And that's different for all of us. And then, like I said, how much can you assimilate? There are some people that when they take continuing education courses, they may say, I'm going to take McKenzie courses, and they just need to stick to the McKenzie piece, because if they start taking some other theories, they get confused. Sure. And there's nothing wrong with that. We all learn differently. So I think a common pitfall is trying to have too many resources and then trying to get through all of them and then not getting through any of them. And then you're kind of not prepared. And that probably also we spent a lot of money. So I think that's number one. I think another common pitfall is don't just rely on your clinical experience. There are conditions out there that can be asked on this exam that maybe you haven't seen. And it's not because they're super, super rare, but maybe it's just the clinic you're working at. Those patients go to another facility or whatever the case might be. So don't just say, I'm just going to base it on the patients I'm treating. I think that's a very common mistake as well. No different than when a student's studying for the licensing exam and they just think about the patient who had Parkinson's disease in the clinic versus what the global presentation of it is. So make sure you're not doing that. Your clinical experience is wonderful. It's why you're sitting for this exam, but it's not the be all end all. Everyone that's taking the exam, those of us that write the exam aren't in the clinic with you, and we don't get to see your patients. So make sure you don't just pigeonhole yourself to that. So I think it's those are probably the 2 main pitfalls that people kind of tend to fall into.
Yeah. So know thyself, understand what's
100%.
right for you, and don't fall into this pitfall, which I did when I was studying for the NPTE, which was watching what everybody else was doing and saying, well, if they're doing it, I must be doing that. And that's, of course, not true.
That's the worst thing you can do, I think. One of the worst things you can do.
Right. And then also, to summarize your last suggestion, which is understand that what your clinical experience is, it might be vast, but it's not not necessarily the entire big picture. So make sure you understand that as well, because that's what's being tested.
Correct.
Perfect. We're going to share all the resources that you had mentioned. We'll put the links in the show notes and the description of the video so people can check off. The last thing we do on the show, Paul-Neil, we call it Words of Wisdom. Wow. You work with students. If someone was about to embark upon the OCS, what's something you might share with them in terms of words of wisdom?
Time management. Again, and I would say what you said, you need to be self-reflective. If it takes you a long time to get through material, there's nothing wrong with that. But this process starts in May when the application process opens, and then you'll find out sometime in the fall when you take it. So you probably have a good 5 to 6 months to study for this exam. And some people need to use every second of that time. So you have to know yourself and know how much time it takes you to get through material, and then plan accordingly. Because if you don't, you may say, I'm going to get through the lumbar spine in a week. And then all of a sudden a week happens and you only got through half of it. Now you start freaking out. You're like, oh my goodness, how am I going to get through everything else? I'm never going to be able to study for this. And we just start kind of catastrophizing and going down that slippery slope. So you need to know yourself. And again, if it takes you a little longer to get through material, that's fine. You just plan for it accordingly. And like with anything in life, time management. And if you know that about yourself, you studied for exams before, kind of how you get through things, just plan your time accordingly. And, I think you'll be in good shape. And another piece, something you said, just because everyone else is doing it doesn't make it right. Yeah. If you're good with group study, maybe there's a couple of other people in your area that maybe across the country and you want to Zoom with that are also going to take the exam. Yeah, maybe you can study with 2 or 3 people and that works for you. For some people, that doesn't work. Right. So again, you need to kind of know that it's not helpful if you're sitting in a group and just listening to people say things and you're kind of agreeing with them and saying, oh, I knew that, because they're not going to be sitting with you when you take the exam. So you just have to be careful about that group study piece, because that can give you a false sense of security. Good wisdom. Paul-Neil, all the way from Stony Brook University on Long Island. Thanks for giving us a little insight into mastering that OCS exam. Thanks so much. Thank you so much, Jimmy. My pleasure.